Good afternoon, oral health stakeholders. Thank you to all that have joined us for this breakout session entitled Closing the Workforce Gap on Dental Workforce Disparities. Closing the Gap on Dental Workforce Disparities. I am Darmyra Perry, and I will serve as the moderator for this session. This session will include 3 separate presentations. All attendees have been muted. Without further ado, we will begin today's presentation, Closing the Gap on Dental Workforce Disparities. Our first panelist is Dr. Edward Peters. Dr. Peters is the professor and chair of the LSU School of Public Health Epidemiology program and an epidemiologist with the Louisiana Tumor Registry. Dr. Peters, at this time, I'll turn it over to you.
Great, thank you, and welcome everyone. And so I'm going to go over in my time the results of a survey that we completed recently, trying to get a handle on the characteristics and distribution of dentists in the state of Louisiana. Next slide, please. So I'm sure all of you on this session are concerned about the oral health workforce in Louisiana and recognize that there are challenges with vulnerable populations, rural communities, and despite efforts to improve access, oral health disparities remain rather high. And so thinking about where dentists practice, not just the location, but the nature of their practices has a profound impact on the oral health services that patients are able to access. One of the concerns that has been raised over the past several months or a few years is sort of the distribution of dentists in the state of Louisiana. So, as I said, this past month and over the past several months, the Louisiana Oral Health Coalition Workforce Work Group, with support from the Louisiana Well Ahead program and the Louisiana Dental Association, conducted a study of the dental workforce in Louisiana. And so this is basically a descriptive survey to look at the characteristics and distribution of dentists in Louisiana. Next slide, please. So this is a web-based survey. We used a program called Qualtrics, and we used as a sample members of the Louisiana Dental Association at the end of 2020. And so in January, Louisiana Dental Association emailed invitations to their member dentists to complete this survey. And we just closed the survey a little less than a month ago. And so the results are fairly new. Next slide, please. So we had 1,878 total members. We emailed a link to their registered email addresses through the Louisiana Dental Association. The response rate was disappointing. For those of you who do survey research, you would like at least around, ideally 50%. This was rather low, 9%, and there are lots of reasons one could talk about that. But essentially, if you look at the characteristics of the population, about 75% were male. They were almost exclusively white, with a mean age of 52 years, and predominantly spoke English only. Next slide, please. Next slide. Most of the respondents lived in sort of the largest metropolitan areas in the state, as you could expect: Jefferson, East Baton Rouge, Orleans, Cato, St. Tammany, where we sort of saw the biggest homes of our respondents. And so thinking about the distribution of where the dentists are practicing, again, it highlights sort of the major metropolitan areas. And you can see that in this map of our respondents to the right here. Next slide, please. When we asked them sort of what was the main factor they chose for their place of employment, most said it was, the largest response was for family care considerations. That was not quite a third, and about 80% of the dentists worked really in one location. 14% of the respondents reported they had 2 physical locations, and 8% reported they had 3 or more locations. Next slide, please. About 3/4 of the respondents were solo practitioners working alone. Only 10% reported they were an employee. Most of the practices had, if you look, about well over a half were had 3 to 6 chairs. And again, the majority were solo practitioners. Next slide, please. What struck me as interesting, you can see on the bar graph on the left, of the respondents, 34% said they had been practicing 31 years or more. And if we look at it in aggregate, almost 50% were practicing 20 years or more. And what also is interesting when you think about this, and if you look at the sort of figure on the right, most of these dentists are only practicing between 20 and 40 hours per week. That's 80%. The number or the proportion of dentists who are practicing 41 or to 50 hours a week is 15%, and a very few are practicing more than 51 hours. So we're looking at sort of a distribution. We tend to have older dentists who have practiced 30 years in solo practices and are practicing, less than 40 hours a week. Next slide, please. And if we ask them sort of the reason why they work less than 40 hours a week as a dentist, most of them state that's their personal preference. We had speculated and thought that a large proportion of dentists might be considering retirement. And I was surprised, and we'll come back to this also, that less than 10% reported they were thinking about retirement or phasing into retirement, despite that many of them had been working, over 30 years in their practice. Next slide, please. So asking them what do they plan to do within the next 5 years, 64% said they wanted to work the same as they do now. Again, 12% said they were thinking about retiring, 2% leaving dentistry but not retiring. So we're not seeing that big a change in the workforce, or perhaps a slight decrease. Again, 50% said they plan on working more than 10 years in the state of Louisiana. And thinking about the age distribution, that probably represents the younger respondents to the survey. But when we ask them what's the main reason they plan to stop working, the ones who do plan to stop working do plan to retire. Next slide, please. One of the things we were interested in is sort of how many are actively participating in the state's Medicaid program. So perhaps not surprising to people on this call, a little over half were not Medicaid providers. And overwhelmingly, most of the reason they cited for not being a Medicaid provider was the low compensation. When we asked those who are taking Medicaid, how many patients do they see in the last month, well over half are seeing between 11 to 100 patients a month. So that's a wide range, but it seems that the ones who are taking Medicaid patients are very busy. When we ask them if they're not currently a Medicaid provider, do they have an interest? Only 3% said yes, 72% said no, and 25% said maybe. And it would be interesting to go back and find out more at some point in a different survey what the maybe people, what sort of putting them on the fence. Next slide, please. We asked them what age they routinely see a child for his or her first dental exam. Again, there's a wide range, but what struck me as interesting as a public health dentist is that 20% said they're not seeing the child until the child's 6 years of age. And to me, that's alarming. That's a large proportion of children who are not getting to the dentist until their adult teeth are coming in. So, it's a fairly large missed opportunity to sort of intervene early with dental education screenings. So I think, that's something that, again, warrants some further exploration. Again, probably not surprising to some people on the call, when we ask them, are they currently accepting certain types of patients, and here I'm just showing the no responses. So the majority of respondents are accepting children aged 0 to 20, but over half are not saying that they're willing to see a child on Medicaid. Likewise, pregnant women. Most dentists will see a pregnant woman. If you contrast the pregnant women not on Medicaid to pregnant women on Medicaid, we again see the disparity that pregnant women on Medicaid, again, I think this sort of is important for Well Ahead and sort of their programming efforts with sort of pregnant women outreach they're doing, is that, the pregnant women on Medicaid are not able to access a dentist. And we see the same thing with sort of adults or adults over Medicaid or elderly. Most dentists are willing to take the patients, but they're less inclined to take those patients who are on Medicaid. Next slide, please. Most dentists were not specialists. And for those who were specialists, it's not, they said they weren't limiting their practice to the ADA specialties. Next slide, please. Trying to stay on time. So again, sort of my conclusions, most dentists who responded tend to be white males with a mean age of 52 years. Most were in solo practitioners in large metropolitan areas. A large proportion have worked 30 more years and working less than 30 out, about 20 to 30 hours a week. 12% plan to retire. Half don't accept Medicaid with low compensation, overwhelmingly cited as the reason. We see the disparities in access for children, pregnant women, and elderly in Medicaid. Have to highlight, one of the biggest limitations of this survey is limited participation, response of only 9%. That could be selection bias or response bias. And it was also limited to LDA members. Next slide, please. So my sort of public health recommendations, I think this, we as dental public health professionals in Louisiana really need to get a much better handle on the data that I presented today. And so many states are conducting annual dental practice surveys in Louisiana. There are examples of increasing the response participation by actually making it mandatory. Some states tie their surveys to the dental practice renewal, and these surveys could be administered jointly through the dental board. Again, I think we're seeing some evidence of still, inequities in oral health care in Louisiana. I think the work with the Oral Health Coalition, Well Ahead, are, advocacy organizations that can work to develop innovative practice models and value-based care. Thank you.
If there are no questions, we'll move to the next panelist. Thank you, Dr. Peters.
You're welcome.
Our next panelist is Gabrielle Juneau. Ms. Juneau serves as the Chief Executive Officer for Central Louisiana Area Health Education Center. Ms. Juneau At this time, I'll turn it over to you.
Hi, good afternoon, everyone. Thank you for the introduction, and thank you to everyone that is joining our session this afternoon. As she mentioned, my name is Gabrielle Juneau, and I'm the CEO for Central Louisiana Area Health Education Center, most commonly known to probably most of you or some of you as AHEC. I'm going to use my time this afternoon to tell you a little bit about our organization, our mission, and what we are doing as an organization to expose students across the board to health career professions and what we are doing specifically for dental recruitment. Next slide. A little bit about AHEC. AHECs are nationwide organizations. We have AHECs in just about every state across the US. Here in Louisiana, we have 4 completely separate AHECs that serve all of our parishes. Because we serve different communities, our missions, our programs look very different with each Louisiana-based AHEC. Concerning Central Louisiana AHEC, we were founded in 1991 as our own nonprofit 501c3 organization, whose mission is to increase the number of healthcare professionals and access to quality healthcare in rural and underserved areas. As part of our mission, we work with a variety of partners to establish pipeline programs that will increase the knowledge and exposure for youth as early as high school. So our target audience is high school, college, and medical students. And you can see here our service area in Central and South Central Louisiana. Next slide. A little bit about our programs that we offer. As I mentioned earlier, we are truly pipeline based. So we know that the earlier we expose students to careers in healthcare, specifically in rural and underserved areas, studies show that they are the most likely to enter into those professions as a career and return to rural communities. So our AHEC of a Summer program was our first high school program that we established back in 1992. It is a 3-week summer program that's open to freshmen, sophomores, and juniors that really truly put them in a hospital-based clinical setting and just expose them to anywhere from 15 to 20 different healthcare professions in a hospital. In the afternoon, we also expose them to careers in dentistry and dental hygiene and dental assistance through actually visiting those clinics. Students that participate or given half of a high school elective credit, they go through CPR certification and they get over 105 hours of volunteer experience. We have roughly 150 students that complete this program annually each summer. Our Day with the Doctors program is a program that allows juniors and senior students to explore different careers in medicine. We are the only AHEC in the state to work with all 3 medical schools. Students, it's a 1-day program during a school day. So students that participate, we work closely with the school boards and the individual school systems to allow those students to be excused from school for all of our day programs. Students that participate in Day with the Doctors, they visit the simulation lab, they tour the medical school, and probably the neatest part of the day is they are able to go into the cadaver lab and glove up and pick up a heart, a kidney, a lung, the brains, and be able to see those basic fundamental parts of medical school in real life and not just pictures in a textbook. Our CI healthcare program is also a 1-day program that's held during a school day where students are exposed to nursing and allied health. And I'll talk a little bit in a minute about how we plan to incorporate dentistry in the upcoming few years. Our Dash into Dentistry program is our newest high school program. Back in last January 2020, we partnered with the LSU School of Dentistry through a contract with Wellhead, Louisiana to offer the opportunity to junior and senior students right now within our service area to explore the careers in dentistry, dental hygiene, dental assistants, and their dental lab program. Last year we had 50 students, and we will have this program again in just a few weeks for another 50 high school students. Our MASH program is our medical application of science for health. Students are given the opportunity to earn 3 hours of college credit through simulation, through case studies. We also introduce them to malpractice mock trials, which is phenomenal. These are all excellent high school programs. All of our programs are offered free to students. We know that a lot of our students, especially in rural and underserved areas, are financially disadvantaged. And with our mission, we never want to discourage students from participating or expanding their opportunities for a career based on finances. Our college programs, right now we have a closer look primary care medicine program, which really kind of throws the student out. Same thing with our professional student programs, but throws them out into a rural primary care practice and allows them to explore what the role of a primary care provider is. So this program looks at pre-med students, pre-nurse practitioner students, and pre-PA students. And they range anywhere from a 1 to a 4 week rotation in a rural underserved primary care practice. Our Rural Scholars Program, which is one of the things that we anticipate modeling for dental school, is right now it's limited to pre-med students in order for them to build up a more solid competitive application to medical school. They work directly with LSU Health Shreveport and Central Louisiana AHEC to get real-time live feedback on their personal statements, their resumes. They go through mock interviews with the admissions committee. And Central Louisiana AHEC is also able to offset their cost of MCAT prep courses and the actual MCAT testing. Our professional student programs, we have AHEC scholars in our primary care rural preceptorship program, which we are anticipating using the exact model for our preceptorship program to roll out a dental preceptorship program, hopefully as early as this summer, if not by next summer. Next slide. We are funded through a variety of funding. State and federal funding is the majority of where our funds come from. We also receive funding from private donors, hospitals, school boards, and Wellhead, Louisiana is a big supporter of our dental recruitment programs. We partner with a variety of community-based organizations. We have a presence in all of our hospitals, preceptor clinics, universities, and colleges within our 17 parish service area. An estimated 70% of our programs are funded directly by our partners through cash and in-kind donations. Next slide. We are one of the only remaining AHECs that actually still tracks our students via telephone call and some social media. To date, we have an estimated 5,520 students that have completed our AHEC program since 1991. And roughly 71% of those students, or 3,908 of our past participants, are either pursuing a career in healthcare or are practicing healthcare professionals to date. Next slide. I want to use the next few minutes just to talk to you a little bit about what Central Louisiana AHEC is doing concerning dental recruitment in the state of Louisiana. As I mentioned, in 2020, we were approached by Wellhead, Louisiana to develop a high school recruitment program that would allow students from our service area and eventually expanding to a statewide program, the opportunity to really get hands-on experience and exposure to what it's like to be in dental school. When we visit the schools in the fall on a non-COVID year, when we're visiting schools, the majority of the students are interested in nursing and medical school. And they're very limited on what they're able to see and do and really what careers are out there. And for the students that are interested potentially in dentistry or dental hygiene, what are their resources out there? How do they make getting to dental school happen, and how do they pay for it? So our program began last January. We had 50 students, as I mentioned, from Central and South Central Louisiana. We had about 23 different high schools that were represented. Our plan for this year before COVID was to expand and double our numbers for this year. However, that definitely looks a little different with COVID. With COVID, we are still having an in-person program this year. We know that having students face-to-face doing hands-on activities, the benefits of that definitely are greater than having virtual opportunities for high school students. Next slide. Next slide, one more time. Okay, so a little bit about the day, kind of how the layout of our day is. AHEC funds 100% of our programs. The students are not responsible for anything. So, and that even includes transportation. We know that a big barrier for our rural and underserved area students not only are, finances, but transportation. It's across the board, not just in our area, but across our state. We have a lot of students that are just disadvantaged with that, and they're missing out on a lot of opportunities. So Central Louisiana AHEC actually funds and transports the students from one central location all the way to the dental school and back to that central location. So all the students are responsible for is getting to and from that meeting point, which is much easier. Once they get to the dental school, everything that they do throughout that day is hands-on activities. They learn the best with hands-on activities. They start with tooth impressions, they go through digital dental scanning, they have a rotation in dental hygiene, dental assistance. Dr. Peters, who just presented, talks to them about the importance of oral health as it relates to public health. Dr. Sheremy at the dental school talks to them about factual information about, how do they make getting into dental school or dental hygiene school? How do they make it happen? What are things that they need to do as a high school student, as a college student? What are financial aid opportunities? What are scholarship opportunities? And how much does it cost? Because that is one of the things that, we hear quite a bit about when we track our students is that, they're having to drop out of school, or they couldn't go to medical school, or they couldn't go to dental school because of the financial barriers. And then we also have a Q&A session with current first, second, and third year dental students from LSU School of Dentistry. We all know that, I can say our programs are great, but it's always best to hear from one of our students. So I just wanted to share with you all a little a video testimonial from one of our students last year. So next slide.
My name is Heidi Reed, and I am a 2020 graduate of Parkview Baptist High School. The Dash into Dentistry program was a great interactive experience. We were able to talk to dental students and participate in several hands-on activities. My favorite activity was learning how to make teeth impressions with the dental students. We also got to use some of the digital dental technology, which was very cool and fun to use. We were also given information about the college requirements, DAT scores, and the application process for dental school. I encourage everyone to apply to participate in this awesome program.
Thank you. Next slide. Okay, so our plans moving forward, some of these are currently in the works, and some of the ones that I'm going to talk a little bit about are where we anticipate moving in the next year to 2 years. So like I mentioned earlier, our Dash into Dentistry program, last year we started out with 50 students. This year with COVID, we are kind of still stuck with limiting our number of students to 50. However, next year we anticipate doubling that number. We definitely have the interest in the high school students and the applications we receive. There is enough interest to definitely justify having 2 program dates and double the numbers. We also, after 2022, anticipate opening up this program to additional parishes throughout the state and allowing other students that have not had the opportunity to do this before, giving them the opportunity to join in our DASH program. We also, with our current partners, I mentioned one of our programs, CI Healthcare, we work with LSUA. They have recently applied for their own dental hygiene program here in Alexandria. We are anticipating doing something directly with LSUA concerning their dental hygiene program or incorporating a dental hygiene rotation into our CI healthcare program that explores nursing and allied health. So it would be a very easy fit. Our summer programs, like I mentioned earlier, also go through a dental rotation. So we are looking at ways that we can expand on dentistry. And then again, our professional student opportunities. We definitely recognize the importance of exposing our dental students if they don't come from a rural community. We want to do our part in exposing them to what it's like in a role of a dentist in an FQHC. Or we have lots of rural dentists who are very much accepting of having students in their clinic. So we are anticipating having a 2 to 4 week rotation during the summer and modeling it after our primary care rural preceptorship program. For this program, we are also anticipating doing a stipend, just like we do for our medical school program, that really serves as an incentive to have these students either go back home for those 4 weeks and shadow a rural dentist or at an FQHC in the state. Next slide. That is all that I have to present today. I thank you for your time. We are always, or I am with Central Louisiana AHEC, always looking for opportunities to expand our mission. So if you are on the session today and you feel that you might be able to contribute or collaborate or partner with Central Louisiana AHEC, definitely let's set up some time to talk. I'm available if anybody has any questions or comments, but I do appreciate your time and thank you.
Thank you, Ms. Juneau.
You're welcome.
Our next panelists are Nicole Coarsey, she's the Population Health Division Manager, and myself, Darmyra Perry, the Primary Care Grant Manager.
Hi, my name is Nicole Coarsey. I'm with the Louisiana Primary Care Office within the Louisiana Department of Health, Wellhead, Louisiana. Today, we will be sharing with you some information about some healthcare workforce development programs that may be useful to your practice or agency as you seek to recruit and retain healthcare professionals. My co-presenter, Darmyra Perry, is the manager of the Louisiana Primary Care Office. The Wellhead, Louisiana Primary Care Office is dedicated to improving the health status of Louisiana residents in rural and underserved areas. Through our work with organizations across the state, we are committed to developing strong community partnerships and integrated primary health care services to reduce health disparities in Louisiana. Wellhead's Primary Care Office serves healthcare professionals, healthcare facilities, state and local agencies, and organizations that provide services in health professional shortage areas and who accept Medicaid, Medicare, and who accept all patients regardless of their ability to pay. Now, the Primary Care Office manages several programs specific to healthcare workforce development. The Health Professional Shortage Area Designation, also known as HPSA, National Health Service Corps, the State Loan Repayment Program, the Small Town Health Professional Tax Credit Program, and we also help with healthcare recruitment and retention. In our time with you, Darmyra and I will be discussing each of these programs. The first area I will speak to is the determination of health professional shortage areas in Louisiana. A health professional shortage area, also a HPSA, is a designation given to an area that is considered underserved by the health providers compared to the population. Simply put, there are not enough healthcare providers in the area to serve the population. HPSAs are approved by the Federal Office of Shortage Designation in the Health Resources and Services Administration located in Rockville, Maryland. They take into consideration a facility's outpatient census, waiting times, patients' residences, and in-house faculty to evaluate the facility's designation eligibility. Now, several assistance programs, they use HPSA designations as a requirement when approving grants and other funding, including the J-1 visa waivers, the National Health Service Corps Scholar and Loan Repayment Programs, and our own state loan repayment program, as well as the 10% bonus Medicare incentive program. Now, on this map, you can clearly see that the majority of Louisiana has a healthcare shortage in the area of dental services. Look at all the green color. All of these parishes have been designated as a health professional shortage area. Now, this means that there are not enough dentists in these areas, which means that the population there are not receiving adequate dental care. The lighter green colors are HPSA designations where the majority of the population is below the federal poverty level. Now, from this map, you can see that there's only 6 parishes in Louisiana that do not have that healthcare provider shortage in the field of dentistry. I'm going to turn it over to Darmyra, who will pick it up with the National Health Service Corps.
The National Health Service Corps offers tax-free loan repayment assistance to support qualified clinicians who work at an NHSC-approved site in a designated health professional shortage area, also known as HPSA. Qualified clinicians include primary care physicians, nurse practitioners, certified midwives, physician assistants, dentists, dental hygienists, and behavioral or mental health providers. There are currently 3 programs: the NHSC Scholarship Program, the Loan Repayment Program, and the NHSC Student to Service Loan Repayment Program. This office supports the NHSC programs at the state level by providing technical assistance to health professionals as they apply for loan repayment, scholarships, and the Scholars to Service programs. Technical assistance is also provided to existing sites in order to maintain NHSC approved status, as well as sites seeking to apply for this program. The goal is to maximize NHSC participation through quality and applications. The loan repayment program provides up to $50,000 to repay qualified student loans of primary care, medical, dental, or mental or behavioral health professionals. There are full-time and half-time options with a 2-year service commitment. To be eligible for a NHSC LRP award, each applicant must, 1, be a U.S. citizen, either U.S. born or naturalized, or U.S. national. 2, have a current, full, permanent, unencumbered, unrestricted health professional license, certificate, or registration in the discipline in which they are applying to serve. 3, participate or be eligible to participate as a provider in the Medicare, Medicaid, and children's health insurance programs as appropriate. The scholarship program awards scholarships for tuition and fees to students pursuing eligible primary care health professionals training. The service commitment consists of a 2-year minimum and a 4-year maximum. The Student to Service Loan Repayment Program provides up to $120,000 to students pursuing degrees in primary care who are in their final year of medical, dental, or nursing school. The service commitment is 3 years of full-time service or a 6-year commitment at half-time service. And remember what I said earlier, these programs are tax-free. Sites must be an NHSC approved site and must be in a designated health professional shortage area. Qualified clinicians include primary care physicians, nurse practitioners, certified nurse midwives, physician assistants, dentists, dental hygienists, and behavioral or mental health providers. Next, I'll discuss the Louisiana State Loan Repayment Program. The purpose of the Louisiana State Loan Repayment Program is to encourage primary care practitioners to serve in health professional shortage areas. For the purpose of recruitment under this program, eligible primary care practitioners include physicians who have completed a residency in family practice, general practice, obstetrics and gynecology, internal medicine, pediatrics, or general psychiatry and dentists. The mission of the program is to alleviate and ultimately overcome the state's problem of a substantial maldistribution of primary care health professionals in rural and inner city areas. The goal of the state loan repayment program is to also increase the availability of primary health care in HIPSAs by assisting in the repayment of educational loans. Physicians and dentists who participate in this program can receive up to $30,000 annually or a 3-year commitment. Other professionals up to $15,000. To be eligible, the participant must work in a federally designated HIPSA. The facility must be a public or nonprofit private entity. They must work full-time in an outpatient capacity, accept assignments of Medicare and Medicaid patients, and the clinic must have a policy and posted slotting fee scale for low-income and uninsured patients. Currently, there are 47 participants in the state loan repayment program. The application period opens again on April 1st, and we hope to support an additional 10 to 15 more healthcare professionals. At the end of this presentation is our contact information. If you want to be notified when the application period opens, make sure to send an email to us requesting to be put on the notification list. Next, we'll discuss the Small Town Health Professional Tax Credit. The Small Town Health Professional Tax Credit allows for approved applicants to receive a tax credit up to $3,600. Applicants' practice must be in a rural area and within a HIPSA designation. Rural primary care practitioners are eligible, including family physicians, general practice physicians, internal medicine specialists, pediatricians, obstetrics and gynecology, physicians, primary care nurse practitioners, primary care physician assistants, dentists, optometrists. The application period for the tax credit opens each year in October. Here, you can see how this program has grown over the past 3 years. You should know that we are limited in the total amount we can award. The maximum per year we can award is $1.5 million in tax credits. We expect the 2021 application cycle to reach that threshold, so submitting an application early is very important. Applications are accepted on a first-come, first-served basis. Next, Nicole will discuss healthcare recruitment and retention support.
Now, in the support of recruitment of health professionals, this office is an organizational member of the nonprofit organization Rural Recruitment and Retention Network, also known as 3RNet, where members are able to connect physicians and health professionals with job opportunities in rural and underserved communities. Now, this office works with rural health clinics and FQHCs in developing and posting job opportunities. This office also provides technical assistance to healthcare professionals in establishing a profile and posting their CV on the site. In addition, assistance is provided to healthcare professionals by connecting them with interested employers. Healthcare professionals recruiting using 3RNet include physicians, nurses, medical assistants, psychologists, dentists, dental hygienists, all types of medical professionals. Now, signing up is free and can be done at 3rnet.org. Another recruitment tool this office has developed is a video series entitled I Am Rural. We spent time interviewing doctors, nurses, dentists all across Louisiana who are providing needed services in rural areas. These videos will be used to recruit qualified individuals to these areas. This particular video is an interview with a dentist who works in an FQHC.
90% of Louisiana residents live in communities with a shortage of dental health professionals, but there is no shortage of culture or community in our state.
My name is Claire Rayfield. I am a dentist and I'm from Metairie, Louisiana. I practice dentistry, general dentistry here in Delhi at a federally qualified healthcare center. Working here as a dentist in Delhi at the FQHC is extremely rewarding. It's more rewarding than I ever thought. We treat anyone who comes into the clinic in need of care, regardless of their ability to pay. If you're a dentist and you're considering working in rural Louisiana, I would tell you, you won't regret it. I feel like I'm truly making a difference in people's lives.
Discover all the benefits of becoming a dentist in rural Louisiana at wellaheadla.com/IamRural.
For information and resources, please do not hesitate to reach out to Well Ahead Louisiana using the contact information shown on this slide. We want to thank you for joining us in this presentation.
Thanks to all of our presenters. We will now take questions. I will facilitate this Q&A session. If you have a question, please type it into the Q&A box. Questions should be addressed to the presenter that you would like to address the question. Okay, it looks like there are no questions. Please complete the summit evaluation. You can find a link to the evaluation in the chat. We ask that you complete the survey as your responses will help guide us in planning our 2022 summit. We value your thoughts and we look forward to reviewing them. We ask that you take some time to review the summit webpage. There are many resources that are shared there. The link is provided in the chat. Lastly, all presentations have been recorded and will be available in the near future. If you have any final questions for the Oral Health Coalition or would like to join, here is the contact information and the names of the executive officers. On behalf of the Louisiana Oral Health Coalition and Well Ahead Louisiana, we would like to thank you for joining us today. This concludes our 2021 Oral Health Summit. We hope that this day was a day you remember. Let's put our seatbelts on and brace for the ride. The road ahead is full of challenges, but just as many wins. Thank you for investing in our plan to achieve better oral health access and equality for every Louisianan. See you in 2022.